I just need to go live on Facebook and then I'll start recording.
It already says it's recording for me, hon. Starting to see some people come on. Hi everyone, welcome. I can see some of you are answering the poll already. If you could just let us know how long ago you had your surgery when you log on, that would be great. Thank you.
Afternoon, everybody. Hope you're well.
Give it a couple of minutes, let everyone join. It looks like we've got quite a good mix of people coming on today.
Indeed, yeah.
Just having a look at how long ago everyone had their surgeries. We'll just give it another minute or so. Hi, John. Yes, you are on. Welcome. Okay, shall we get started then?
That's good.
Yeah, perfect. Well, hello everyone and welcome to today's webinar. This is a webinar on a how-to guide for freehand speech. So we're just going to do a little bit of housekeeping before we get underway. Just going to have to read this disclaimer. So this is a corporate presentation from ATOS Medical Group. Nothing in this presentation provides any diagnosis, clinical advice, indication, guide, warranty or guarantee. Nothing in this presentation can substitute individual advice or guidance given from a qualified healthcare professional. This event is being recorded and live streamed on Facebook. So by joining this webinar, you are consenting to being recorded and live streamed during this event, although I don't think anyone's cameras are on today. So, and also I should just mention, if you would like to comment or if you would like to ask any questions throughout today's webinar, you can use the chat box or the Q&A box if you're joining via Zoom, and we'll answer those at the end. And if you're watching live on Facebook, please just comment on the video and we'll get to those at the end as well. Thank you. So my name is Jess. I am the current head of nursing here at ATOS Care. And today I'm joined by Alison Dempster, who is one of our clinical educators, speech and language therapist.
Hello.
And we've got Jack as well, who is one of our nurses.
Hi.
Okay, so we've opened the poll. So hopefully everyone's answered that as you came on. So how long ago did you have your surgery? So as I said, there's a really nice mix, but probably most of you are kind of between the 3 to 5 year mark by the looks of it. We've got a few long standers at 10+ years and a few that are less than a year. So welcome to everyone. Okay, so I'm going to hand over to Alison now, and we're just going to talk a little bit about communicating after a total laryngectomy. So Alison, over to you.
Great, thanks very much, Jess. Well, hi everybody, welcome to our webinar this afternoon. And I think most of us would agree that our voice is a big part of our identity and who we are, and we can certainly express ourselves and how we feel using our voices. Now, before laryngectomy, your voice was produced by two folds of tissue called the vocal cords. Also called the voice box, which sat in your throat or your larynx. Now, vocal folds vibrate when air comes up from the lungs and passes through them, causing them to open and close, making a voice. So we're just going to watch a video clip now of vocal cords vibrating to make that voice. Okay, thank you. So that's a sort of bird's eye view of the vocal cords, and then the cords moving together and being blown apart as air moves up through them to make a voice before laryngectomy. So if we can just move on to the next slide, please. Because having a laryngectomy removes the larynx and removes these vocal cords, the way that you speak has changed. There's no longer a voice being made by the vocal cords. For those of you using a voice prosthesis after surgery, the voice is now made in a different way at the back of your throat in the food pipe. And this is caused by air from your lungs being diverted through the voice prosthesis, making the tissue at the back of your throat, where you swallow food, vibrate to create a new type of voice, much like the vocal cords vibrated. This sounds different to the voice you had before your surgery, but many people can use it very effectively. So we're now going to look at a video clip of how the voice is made with a voice prosthesis after laryngectomy. Okay, lovely, thank you. So hopefully you can see the tissues vibrating, moving together, being blown apart, much like the vocal cords before laryngectomy. So, you know, it's just useful for us to have an idea of what's happening when that new voice is made. So just moving on to the next slide, please. So as I said, some of you make your new voice using a voice prosthesis, or you might call it a speech valve. And this is a small plastic device seen here in the picture on the right-hand side of the screen. The voice prosthesis sits between the windpipe and the food pipe, or esophagus, as you may call it, and it has a flap that opens to let air through it, causing the tissues in the food pipe to vibrate, this enabling you to speak. The flap in the voice prosthesis closes when you eat and drink and breathe. So to make a voice using a voice prosthesis, the stoma must be blocked either with your finger or by pressing down on an HME, so that that air can be directed through the voice prosthesis instead of being lost from the stoma. Air then travels through the voice prosthesis, up through the food pipe, and the tissues at the back of the throat then vibrate to create the voice. But other ways you may voice include esophageal speech, and this is when you swallow air that's in your mouth and it's pushed back up into the upper food pipe or esophagus, which causes a vibration, making a sound. So the sound is then shaped into words by the tongue and the lips. You may also use an electrolarynx, as shown here in the middle picture. Now, the sound is generated by the electrolarynx, which travels through the tissues of your neck or your cheek, maybe, up into the mouth. And it's then shaped by the tongue and the lips and converted into understandable speech as well. So moving on to the next slide, please. Now, it's important to say that some people may not be suitable to use a voice prosthesis after laryngectomy, and your surgeon at the hospital and healthcare professionals at the hospital will advise you whether you are suitable for a voice prosthesis. If you do have a voice prosthesis, it's important that you have a good cleaning regime using a brush and a flush to keep the voice prosthesis clean and clear. A clean, clear voice prosthesis will allow air to move through the voice prosthesis freely without any obstruction. If the voice prosthesis is not clean and is, for example, blocked by mucus, air won't be able to move through and your voice will be affected. And because part of your voice prosthesis sits in the food pipe where bacteria and food and mucus are bypassing, this can become stuck in your voice prosthesis and may block it or interfere with the way that the flap closes. This can lead to leakage through your voice prosthesis, making you cough. So it's really, really important that a voice prosthesis is cleaned at least twice a day, and a clean voice prosthesis may also last longer without needing to be changed. So some tips to make sure that your voice prosthesis stays clean and clear are making sure you drink plenty of fluids after you've eaten to wash any food or mucus down and prevent your voice prosthesis from becoming blocked. You should ideally clean your voice prosthesis after every meal. Certainly, as I said, cleaning it a minimum of twice a day will help it stay clear and clean. You should also keep an eye out for any signs of leakage through the voice prosthesis. As I said, this can affect your ability to speak and needs to be dealt with as soon as possible. So I am now going to hand to Jess for another poll question. So if we move on to the next slide. Thank you.
Thank you, Alison. So we are just curious to know, what is the main method of speech you're currently using? Just select the most appropriate one. Voice prostheses, electrolarynx, esophageal speech, pen and paper, sign language, text-to-speech apps. We'll just give you a minute. Okay, so most of you are voice prosthesis users. That's 91% of you. 5% of you electrolarynx and 5% of you are pen and paper. Thank you very much. So
Great. So
we're going to move. Sorry, Alison. Go on.
That's okay. Thanks, Jess. So now we've looked at all the methods of voicing after laryngectomy, I'm going to move on to talk about something called Freehand's FlexiVoice. And some of you may already use this or have tried it in the past at some point. So just moving on to the next slide, please. So speaking hands-free after laryngectomy is something that you may be able to do if you have a voice prosthesis, and a lot of you do that are with us today. This means you can produce a voice without blocking your stoma with your finger or by pressing down on an HME. And it's certainly something that many people want to achieve after laryngectomy. Having both hands free means you're able to make gestures with two hands while you're speaking. And talking to people will feel more familiar, like what you used to do before your surgery. Many people have said, in fact, that speaking hands-free is more like life before surgery. So the hands-free speaking valve closes the stoma instead of the finger, and then the exhaled air goes through the voice prosthesis to make a voice. Now, I just wanted to stress something, though, that your clinician will be able to advise you whether Provox Freehand's FlexiVoice is suitable for you, and will carry out an assessment procedure. Okay, so we now have another poll question, lots of poll questions today. So if we move on to the next slide. So our poll question now is, have you tried using Freehand's FlexiVoice at any point in the past?
Just while everyone's answering, Alison, we've just had something come through in the Q&A. It says, it's from Jan, and it says, what about tracheostomy speaking valves? So we should just mention that this is for laryngectomies, this webinar. Tracheostomies are a little bit different, and we will have some webinars in the future on speaking with tracheostomies, just to clear that up.
Definitely. So I'm just looking at, thanks Jess, I'm just looking at the answers to the poll questions. So, my goodness, 71% of you that are with us today have tried free hands in the past or are using it at the minute. So that's a really high number. Maybe we can discuss later how many of you are finding that that's working well for you. And 29% have said no, they've never tried it. Okay, great, thank you for that. So I'm going to hand over to Jess now. Who is going to, oh no, it's not Jess, it's still me, I think.
Yeah.
Still me. Jess and I are sort of talking on different slides today, so we're chopping a little bit. So that's the slide I'm after, yeah. So this is a picture of the Provox Free Hands FlexiVoice, which a lot of you will recognise, given that so many of you have tried it or are using it at the minute. So it has a special silicone membrane on the underside, as we can see here on the right hand picture. And this opens during quiet breathing to allow you to breathe without any feeling that there's any restriction there. But when you start to speak, that membrane is moved forward by the air pressure coming up from your lungs, and that's what closes the membrane. So it closes that window off so that the air can't leave the device. So it's shunted through the voice prosthesis and into the food pipe. Okay, so that's a very quick summary of how it works. So moving on to the next slide, please. So let's just think a minute more about the benefits of freehand speech, because as I said earlier, free hands will allow you to use more natural communication. It's quick and easy to set up with your clinician. It has a helpful arch to keep clothing away from the device. It's also available in 4 different membrane strengths for different people. So the device is attached to a heat moisture exchanger with one single click. So you'll still have the benefits to your lung health of the heat moisture exchanger and the benefits of that HME. We're now going to have a look at a video clip of somebody that uses free hands FlexiVoice. His name's Bill.
Speaking hands-free really gives me the confidence to get back to normal and interact with people the way that I did before. I used to do gliding at the weekends as a hobby, and I had to give that up. I'm now planning to take lessons and learn to fly powered aircraft. I enjoy driving and going and seeing places with my wife. Now I can do that again, and I'm able to talk to my wife in the car on the way there. Freedom to me is all about independence. But if you were to ask my wife, she would say it's when I do the cooking. And she knows I cook a good Sunday roast. We'll get the family around the table and we'll have some good food and a good chat, and there's nothing better than that. And when people that seen me months ago with the manual haven't seen me for a while, and they see me talking to them now, they say, it's just like having you back, Bill. And it's amazing.
Okay, thank you. So hopefully that's given you an idea of how beneficial this device can be for people, and the freedom that it gives them to do their daily activities without having to occlude their stoma or press down in their HME. Okay, so let's have a closer look at when you might use free hands FlexiVoice, and Bill certainly told us about some of the situations that he finds it useful to use in. So it can be used when you do everyday things like talking with family and friends in a more natural way, and to blend in more comfortably in social situations. Working life can be easier too, especially if you depend on both of your hands to do your job. Activities such as cooking, driving, speaking on the phone and taking notes all become easier as you have 2 free hands to use instead of 1, and it's more natural. Now, it's important to use freehands HME for your situational needs and alternate with other HMEs, such as the home or the go, for improved lung health throughout the day when you're not using hands-free speech. So changing your HME depending on your situational needs can also help to extend the life of your adhesive, because it gives the base plate a rest from that extra pressure under it that occurs during freehand speaking. So next slide, please. Okay, now freehands FlexiVoice can be used with the new Provox Life Heat Moisture Exchanger, and we can see an image of this here on the right hand side. The heat moisture exchanger will provide good humidification, which in turn can reduce coughing and mucus and these bothersome symptoms. The FlexiVoice can be easily removed from the HME without needing to use the removal aid, and FlexiVoice can also be used with any of the Provox Life adhesives, tubes and buttons. So next slide, please. So in terms of who may be suitable to use freehands, it only works if you have a voice prosthesis, and freehands can be used with any brand of voice prosthesis, not just a Provox voice prosthesis. You should also be able to achieve reasonable voice with your voice prosthesis. If you've got difficulty producing a voice before you try freehands, it might also be difficult for you to achieve a voice using freehands, but that will be assessed by your clinician, and your clinician will certainly advise you on that. The way that air flows through a voice prosthesis is also important, and this is something again that you may wish to discuss with your clinician. Before starting to use freehands, you should be fully familiar with your voice prosthesis and any base plates, tubes and HMEs that you use. Again, your clinician is the best person to advise you whether freehands are suitable for you, and they'll be able to conduct a freehands assessment to find out the most suitable strength of membrane, because different people need different strengths of membrane, and that has to be assessed. So next slide, please. Something else you should be able to achieve is a good base plate seal around the stoma, as base plate seal is really important when using freehands. You'll be required to operate and remove freehands FlexiVoice from your attachment independently. And if you've got any difficulty using your arms or your hands, it might be tricky for you to use freehands FlexiVoice. Getting to use freehands can take time and adjustment, but perseverance in practice can definitely pay off. Lastly, freehands can be used with any brand of voice prosthesis, as I've said, not just Provox products. So if we move on to the next slide, I'm going to hand back to Jess to have a closer look at the freehands FlexiVoice device.
Thanks, Alison. So yeah, as Alison mentioned, we're going to look at getting started with the freehands FlexiVoice. So if we just pop to the next slide, please. So as Alison mentioned earlier, there are different strengths of membrane for the freehands FlexiVoice. There's 4 different types: the light, the medium, the strong, and the extra strong. And the reason for this is that different people will need different membrane strengths depending on their general kind of physical strength, their general kind of lung health as well, and lung strength. And it's really, really important that your clinician carries out an assessment to determine which one is suitable for you. And it might be that actually you need more than one different membrane strength. You may need a certain strength for, you know, sitting down, having a relaxed conversation, as opposed to kind of walking through the park when you're kind of getting a little bit needing a bit more air and getting a little bit out of breath if you're walking and talking at the same time. So really important that your clinician, you know, carries out that assessment. Can we move to the and the reason for this is that different people will need out that assessment. Can we move to the and the reason for this is that different people will need out that assessment. Can we move to the was anyone else just getting that feedback?
Yeah.
Oh, I'm sorry. I was very confused. We'll move to the next slide, please. Perfect. So the device can be set to 2 different modes. So speaking mode, this is where the membrane can move freely to kind of cover the opening of the hands-free speaking device. or it can be in locked or open mode, and this holds the membrane open. For example, as I said, when you're kind of taking a walk and a talk or exercising, you need a bit more airflow through your HME to kind of breathe. And all you need to do is just turn the device a quarter clockwise, so that to the right hand side. That's right, Alison, isn't it? Mm-hmm. And that will pop it in the locked mode, and then you just turn it anti-clockwise to release the membrane so that it can close for freehand speaking. So it's just worth mentioning, if you have got it in the locked mode because you're needing a little bit more airflow, you can actually use kind of what we call digital occlusion or finger occlusion to pop your finger over the hole where the membrane is, and that allows you to speak as well. Obviously it's not hands-free at that point, but it gives you the option to do both. If we can pop to the next slide. So we just need to talk a little bit about coughing while you've got the free hands in situ. If you can, you know, we always say, regardless of whether it's free hands or just a regular HME, if you can anticipate a cough, you should always remove the entire thing. So the free hands device with the HME attached to it. So just remove that. But we do kind of understand that it's not always possible to anticipate a cough or catch it in time, and that's perfectly fine. But it's just worth noting that the membrane will likely pop out, and that's fine if it does. You just need to pop your finger back and pop it back through the hole to set it back in place, just like shown in the picture on the slide there that you can see. Pop to the next slide, please. And as Alison mentioned earlier, we've got a helpful arch that can prevent against kind of accidental occlusion. So it's just shown there on the top of the screen. That's what it looks like on its own. And then just below that is what it looks like when it's actually attached to the free hands device. Why would you use this? You know, if you've got a t-shirt on, you don't want it to occlude, so you can pop the arch on to stop, you know, your clothing from getting kind of occluded in the device. And it's really, really easy to kind of connect and disconnect. It just simply clicks in place over the top of the device. So we're going to hand back to Alison now, and she's going to talk about how to use the support for free hands.
Great, thanks, Jess. So yeah, I just wanted to say a little about something called the Provox freehand support. So if we move on to the next slide. The support, which we can see a picture of here on the top right hand side, is something which can be used with free hands FlexiVoice and can result in people achieving a better voice. It works by providing support to the stoma and the area around the stoma, which can sometimes move forward when people use free hands FlexiVoice. Now, this may cause base plates to blow off early and a deterioration in the voice quality that you can achieve. So by using the support, it reduces or stops forward movement of the stoma and the neck and diverts that air through the voice prosthesis. So let's take a look at a video clip to see how the free hand support can work.
I can still talk, but it's a lot more effort has to go in to get the volume. But what happens is the extra support that's bit here just applies a little bit more pressure at the base of the filter, gives you a louder voice. It's more sustainable.
Great, thank you for that. So hopefully you could hear the difference there in that second part of the video clip, where Bill's voice was louder, stronger, and a lot clearer when he had the Provox support over his free hands FlexiVoice. Okay, so if we move on to the next slide, just have a look at this support in a bit more detail, because it comes in 3 varieties depending on how deep your stoma is. There's a flat, a medium and a deep support, depending on the depth of your stoma, because we know that some people's stomas are very flat, other people have deep stomas. And again, your clinician will advise you which one might be the right one for you and how to attach it to the FlexiVoice. But basically the circular head that you can see, the metal head, just hooks over the entire Freehands FlexiVoice and attaches to the chest with a sticky attachment piece. And we can see in the bottom picture the Provox support in use. Yeah, so moving on to the next slide, please. So as I mentioned previously, one of the ways that the Freehands FlexiVoice can be used is by attaching it to an adhesive base plate. So let's have a look at that in more detail as well. So if we just move on to the next slide, please. Great. So the Provox Life Stability adhesive, which we can see here on the right-hand side of the screen, which some people may know about already or even use at the minute. It is an ideal base plate to use with Freehands FlexiVoice, and many users who use this base plate experience very good results because it is strengthened with vertical bars for better adhesion to the skin around the stoma, and that can withstand freehand speaking to a greater extent than some of the other base plates. It's a more solid base plate, and it's also good for deeper stomas because it's got a little recessed portion on the back. However, you should use whichever adhesive fits best around your stoma and feels most comfortable and achieves the best airtight seal possible, because this is key to freehand speech. Now, the Provox Life Stability adhesive is clover shaped, which means it's more flexible for a better fit. It has softer coupling, which is the round area on the adhesive that the HME fits into. And this can achieve a closer fit around the stoma, and it's stickier than other base plates, making this a really good choice for hands-free speaking. And data that we've actually got from the early stages of when Provox Life base plates were being developed revealed that people who used the stability base plate with Freehands found it very comfortable with a good fit, as well as actually lasting longer before blowing off compared to some other base plates. Next slide, please. So if you need to wear a laryngectomy tube, which many people do, you can still use Freehands FlexiVoice to achieve a good airtight seal around the stoma, which is key, and reduce air leak. If you use a laryngectomy tube, we would definitely suggest using the Provox Life ringed laryngectomy tube, which has a white ring on it and fits into the Provox Life base plates. And this allows air to flow from the tube through the voice prosthesis. And certainly you should use the laryngectomy tube, which is small holes called fenestrations, to let that air through the tube into the voice prosthesis. And again, your clinician will be able to advise you on this, but we can see in an image on the bottom right of a white ringed tube in a base plate. Okay, so similarly, Freehands FlexiVoice can also be used by some people who wear laryngectomy buttons, but again, your clinician will be able to advise you on this. So next slide, please. So now I'd just like to go through some tips to help you achieve the best from Freehands FlexiVoice. So if we move on to the next slide. So I keep sort of saying this, but your clinician will be able to work with you and advise you on FlexiVoice so that you can use it as well as you can. If your stoma is moving forward too much when speaking with early base plate blowing, you might want to consider discussing the freehand support with your clinician. If speaking becomes difficult with freehands, again, reach out to your clinician, because there's certain techniques that clinicians can speak to you about to help that. It is beneficial to use a constant gentle pressure when using freehands and resist the temptation to force or strain your voice. And this can also result in base plates lasting longer and therefore improved voice quality. Remember that when you're being physically active, you can turn your FlexiVoice to locked open mode if you need to get more airflow through the device when you're breathing and getting a bit out of breath during exercise. To improve your voice quality, you can practice coordinating your breathing and your speaking. Should you need to cough, as Jess said, when the FlexiVoice is in place, try to remove the device before you cough if you can, but if you don't manage to remove it on time, that's all right, but you might need just to pop the membrane back through with a finger. And lastly, try to be patient because it can take time to get used to this different way of speaking, but once you've learned to use it, it can become second nature to you. Okay, I'm going to hand back to Jess now, who's going to talk about a patient who uses free hands.
Thanks, Alison. So yeah, we're going to meet Paul now. We're just going to watch another video, and this is Paul talking about his free hands experience.
So good afternoon. As promised to the numerous people who requested, well, there were 3 of them, here's a video of how I operate with the Provox hands-free system. Excuse any sweat beads which might appear on my head. This has been taken in my office at home, which is south-facing and is roughly the same age as the core of a first core even put my teeth in. So I've been using the hands-free for around 4 years now. The new Suitability base plate, I think, is a game changer for it. It works really well. I've had this one on since this morning, and as I say, it's about 30 degrees. It's working fine. I mean, they tend to last a couple of days. My speech and language therapist reckons I should take it like every night and clean it and be stronger, have a bit of a rest, but I don't always follow what the speech and language therapists say. Here is the unattached version of the HME and the filter. That's the HME, that's the filter. Simply push it together, stick it in your throat, and pop your uncle. You can only talk as long as you've got breath. So it's not a good situation of talk. You've got to take a breath as well and have a pause. But you can see there is a certain amount of oscillation when you do make the voice. But I've got my hands free, which just makes it far more confident, especially when I'm meeting people, especially for the first time. I'm trying to explain what this is. The way it works is the air oscillates within the HME. I mean, you can create a voice exactly the same as a push HME, but without the necessity to push. As I said to somebody on the message earlier this week, when I used to work full time, I had a very much hands-on, face-to-face telephone type role, and I found it working with hands-free all day, every day would make me very, very tired. So I would often just do the push to make it easier. You get slightly less air through the HME in this format. If you want more air, you can turn it to one side and you'll get more air in. But you won't make a voice. I use that occasionally if it's very, very hot, or if I'm out with a dog walking up a hill or something like that. It can be a bit of a challenge. I've tried the bronzing a new version. The base plate is probably superior to this Provox one. However, I found that the HME they used was very fiddly. There was a very fine line when you're adjusting it to being able to make a voice and to be able to breathe, which is always quite handy. It also, I found, is a little bit wistful and looked a little bit more industrial than this one does. Okay, no one's ever going to not notice the fact we've got a bit of plastic sticking out our throats, but making it look slightly less slightly less visual is what I think is not a bad idea. Anyway, I need you to not be talking now for nearly 4 minutes with this without any difficulties at all. If anyone's got any questions specifically, just send me a PM. Anyway, cheers.
It's a really lovely video from Paul, and just a little bit about his experience with free hands. So looks as though he's enjoying it. So let's just pop on to the next slide, please. So, you know, we've spoken a lot about free hands and how to get started, and a little bit about the way you connect it and the different kind of bits and bobs it comes with. But if you are interested in our online workshop, we've got an online workshop next week, so the 27th of September, so it's next Tuesday at 2 p.m. And that will be with Faye, who is another clinical educator, speech and language therapist by background, and she will be on there with you guys. It's a chance for you to turn your cameras on. You can have a nice interactive chat with everybody, and Faye will be going through kind of live demonstrations about the free hands, and also you'll be able to ask questions kind of directly to her, and have a think about that. And if you'd like to join, you can either scan the QR code that's on the screen now, or you can register online. If we pop to the next slide. So, as always, you can access lots of support that we offer here at ATOS Care. So we've got our customer care team. They can help you with, you know, anything you like. They're very good at signposting, orders. Their details are on the screen there. We've also got our lovely nursing team. If you think you need some support at home, please give your customer care representative a call, or get in touch with us, and we can look at coming out to see you if you feel you need a bit of extra support. And of course, we've got our MyLife online events, so you can register for future webinars and workshops. It's always nice to see everyone turn up. So yeah, thank you very much. So that is the end of our presentation, and now we would like to just invite any questions. I can see that there's been a few trickling in while we've been talking. So if we hand over to Jack, I think he's been monitoring the question box. Anything come through, Jack?
Thank you. We've had a couple of questions in over the last week since the webinar was announced. One of them is, I have difficulty connecting the HME to the device. It's fiddly. Have you got anything you could suggest to help with that?
Yeah, shall we shoot this one to you, Alison? I think
Yep, absolutely, no problem. The best way to attach the FlexiVoice to the HME is by placing the HME onto a flat surface, which in this case is my hand. So I've placed my HME onto that flat surface, and just double check that you have the HME the right way around, because it's got the mucus shield on one side with the 3 stripes and the name free hands, and that's the bit that it goes into the base plate. So the actual free hands FlexiVoice device is clicking in to the side that just has, I don't know if you can see that, 2 sort of semicircular bits of plastic. So that's the bit that's going on top of. So you would put your HME on a nice flat surface, pop the FlexiVoice over the top and push down, and hopefully you could hear that click. And then it's ready just to pop into the base plate or the Larry tube, whatever attachment you use. And then in terms of removing, you can hopefully see that on the Provox Life HME, there's a sort of a little lip here. It looks a bit like a baseball cap, the peak of it. But what you can do is just remove these 2 items and separate them quite easily without using a removal aid, because with the Provox HMEs, which look slightly different, so that's the new Provox Life HME, and that's the Provox, so it looks a bit different. That's the mucus shield, so that's the side that goes into the base plate. We needed a special removal aid to remove the FlexiVoice from this, so if I just show you, so I've just put my Provox HME on my hand, whoops, and I'm going to click this onto the top. I'm going to use my desk actually, because it's okay. So I've clicked that on there. That's very difficult to remove with your fingers, and many of you will have used this removal aid in the past. which just crushes the HME and it comes off. But you no longer need to do that with the Provox Life HME. You should just be able to take the two bits apart. Does that answer that?
Perfect, thank you.
Thank you. We've had a question from Alan. The main issue that he finds with using the free hands is that his base plates keep blowing.
Yeah.
I don't know, Alan, if you're already using the stability base plates, if that's something that you're using at the moment. Have either you or Jess got any suggestions on how to make his base plate last longer?
Yeah, there's definitely a few different ways, isn't there, Alison? I think you know, from a nursing point of view, make sure that your skin preparation is tip top for the base plate. You know, make sure you are removing it properly and cleaning the remover off before you reapply a base plate. Make sure you're allowing it all to dry and you put a nice bit of skin barrier on before you pop the base plate on. If a base plate is, you know, if you've kind of gone through many base plates and you're still not quite finding the right one, it might be that you need a little bit of an additional silicone glue maybe to keep it in place. That's some of the kind of immediate options you can try to get your base plate to stick a bit more. But then, Alison, you've probably mentioned support, or
yeah, I mean, just following on from what you said, Jess, about the skin prep, you can also prepare the actual base plate by heating it up in your hands first.
yes,
Just spend a bit of time just to activate the glue. Certainly using the stability base plate, which is the really good strong one that's going to withstand more pressure. And it's well worth just taking time to massage that base plate into the skin. So starting with the round circular part, that's now quite bendy and flexible on the stability base plate. So you can actually bend it and get it in really deeply to get a really good fit, and just spend some time massaging that round and then massage the rest of it. And it is worth taking time just to make sure there's no air bubbles and it's all really stuck really well. Something else that we know from people who use hands-free is it's quite good to keep that base plate on for about 20 minutes, half an hour before starting to speak, because it just lets everything bond to the skin. So when you do start to use it, it's less likely to blow off. But certainly taking the time to make sure there's no air gaps. And if you have one particular area around your stoma, which people often do, that where the air leaks from, maybe just dabbing it with a bit of silicone glue, just like Jess said. But something else that can really help is the Provox support that we spoke about, because that air wants to move forward when you use free hands. It will take the path where it's easiest to get out, which is forward, sadly not through the voice prosthesis. So just providing a support there will hold the air back, hold the neck tissue back, so that that air goes through behind, through the voice prosthesis and up into the food pipe. As I mentioned earlier as well, it's really important for base plates not to blow, that you don't force your voice, because the temptation is to try and use a loud voice, especially if you're out socially, and maybe force it a little bit, and all that's going to do is just blow that base plate off. So a good idea just to use a nice gentle pressure when you're speaking. And also think about keeping your free hands voice for those really important situations where you really want to have both hands free. So when you are talking to people, and it, you know, in a social situation perhaps, where you want to have your hands free, or at work, and all the things we spoke about during the presentation. And you can even alternate hands-free and digital occlusion. So you can put the membrane into an open lock position and just occlude the window of the free hands device with your finger. And that just again saves on that air pressure, because you're providing some resistance at the front and the air is going to go back. Okay, so I hope that's given people some sort of tips. There are things that we can usually try out if you're having a problem with free hands. There's usually a solution that we can work with you on to get the best out of it.
yeah, thanks, Alison.
Thank you. Michael has asked, he's tried using free hands, he struggles to get a seal with his base plate as he has a very deep stoma. He finds that the top of his stability base plate always comes off.
Yes, so I think finding the right base plate can be a bit of a trial and error, a long trial and error situation. I would say, Michael, you know, listen to everything that me and Alison have just kind of given advice on in terms of making sure the skin's prepped. Like, can't stress that enough. You know, there's a lot of people that don't take the time. You know, it feels like it takes a little bit of extra time out of your day, but actually in the long run, you prep it all correctly and warm up the base plate correctly and activate that glue, then, you know, it saves you a couple of base plate changes throughout the day, basically. But what I would say is, if you are still struggling, I'm not sure about whereabouts you live, Michael, but it might be worth reaching out to see whether your clinician has any ideas, if you still see your clinician, or if you want one of our nursing team to come out and pay you a little visit. You know, sometimes it helps us just to have a visual on you and to have a conversation with you in person. Or you can jump onto the workshop next week and be on camera and kind of give us a little bit of an idea online in the little group chat and see what's going on. So it can be a little bit tricky. It might be that your positioning is not quite ideal and you just need a little bit of guidance on the best kind of way to apply the base plate. Sometimes it can be fiddly with these really deep stomas, and there's a few different things that we could try, but it's definitely something that's best done in person with your clinician or one of our nursing team.
And just something to add to that, Michael, Suitability adhesive has the vertical bars, but they don't have to stay in the vertical position. They can be rotated just to fit with what's best for your tissue. And it often is just one spot that the air just keeps leaking out of. So it's kind of just finding maybe a way to manipulate the base plate, really sort of bend it as you're placing it around your stoma to make sure you've got that really good seal of the round coupling, and taking the time to massage and maybe a wee bit of glue as well. So trying all these different things, but like Jess said, you know, in person is definitely the best way to work with you to help you get the best out of it.
Yeah, absolutely. Good.
We have got another question from Ian, who's finding that his voice is very quiet when he's using free hands. Could you talk a bit more about the support device that you mentioned?
Yep, so as I said earlier, the support is a really, really useful device that can help you get a better, clearer, louder voice. We saw the difference in Bill's voice on the video clip before he used the support and then after, and there was a distinct difference because, again, it's to do with the way the airflow is moving in the direction that it's moving in. And sometimes people do experience lots of forward movement of air depending on how sort of lax the tissue is round about the stoma. So it's important just to provide that stability that the support can provide to keep the neck tissue sort of more stable, and therefore more air will move back through the voice prosthesis. And you know, something else you can do is speak to your clinician about how wide your voice prosthesis is. That may be something that can help after other things have been tried, but certainly there's a few things you can try first. And just really practice and having really good coordination of your breathing and your voicing, and the way that you breathe can often have an impact on how good a voice you can get. And we would encourage a technique called deep central breathing, and this will be something that's spoken about more in the workshop next week. So it's a method of getting as much air as you can, as efficiently as you can, through that voice prosthesis into your food pipe to make these tissues vibrate.
Great, thank you. What else have we got coming in, Jack?
Patrick's asks, what way round should the stability be fitted? So
Alison mentioned earlier, so you've got what I like to call the scaffolding in the stability, which is kind of the hard plastic bit. And as Alison mentioned earlier, it can kind of be whichever way round fits you best. So, you know, some people will have very prominent kind of tissue and the way that their stoma is deep set, and sometimes it makes sense for the scaffolding, the plastic bit, to be vertical. Some people it actually fits better more horizontal. It really can be fitted no matter what way, as long as it kind of molds to your shape stoma. And if you're still having problems, Patrick, definitely reach out to your clinician to get kind of a face-to-face assessment and some guidance. And also, you know, we at the nursing team here, we here at the nursing team are happy to come out and see you if it's suitable, to come and pay you a visit. But yeah, any way round is the way the stability can be fitted. Perfect.
Good. And also, Alan's asked, he has a strenuous job as a delivery driver, and he finds that the freehands doesn't give him enough airflow when carrying the customer's trays. Have you got anything you could suggest to help with that?
Yeah, definitely. I mean, as Jess said, and as I have said in the presentation, you may need 2 different membrane strengths. One for when you're being physically active and maybe carrying something, and another one just as you're sitting, relaxing, chatting, because we know that the air pressure coming up from the lungs is very different in these situations. So, you know, it may be that you lock the membrane back into open position, because we definitely don't want that membrane blowing forward when you're just moving around. It should only be coming forward when you speak. When you breathe, it should open again. But it may be that sort of the membrane that you use to speak when you're sitting down is blowing forward when you're exercising. So that would be a case of going back to your clinician again. You may need a stronger membrane for when you are at work that holds back and doesn't blow forward, or you could lock it back as well. So it would just be, you know, getting that assessment done just to find out what suits you in what situation.
Right. Perfect. Can also see Christine here as well, or Mark actually. Mark said, would it be possible to ask how many people are using hands-free every day? Sounds like we needed a poll earlier in the presentation, but I mean, if anyone wants to comment on whether they do or don't use free hands every day, please feel free to let us know. We'll come back to that in a minute. And Christine had something to say, Jack, didn't she? I think. So she uses sensitive base plates. Are these available for hands-free?
Yeah, I mean, if you know, any base plate can be used with the hands-free FlexiVoice if it works for you and you get a good seal. The reason that we recommend the Stability is because it's stronger and it's less likely to blow off. But if you need to use sensitive and that's what's good for your skin, then yeah, absolutely, it can be used with free hands as well. Yeah, certainly not as the good thing about sensitive is it's a lot stickier than the equivalent in the older Provox range, the Optiderm, but you know, it's still something that you can try, and you can just prioritize when you use your hands-free FlexiVoice for these situations that are really important for you to have 2 hands free.
Yeah, great. What else have we got in here? Let's have a quick look. So in the question and answers, we've got, how can you stop the base plates from bulging when using hands-free? I think we've discussed quite a lot about this, but just to reiterate, Alison.
Yeah, I mean, if the tissue's bulging forward, if your neck tissue's moving forward when you're using hands-free, and obviously the base plate will bulge forward, I would certainly recommend speaking to your clinician about a support just to hold it back and give you a better voice and keep those base plates on for longer.
Yeah, great. And we've got someone asking, could you kindly send a complete package of hands-free system to me? If you could get in touch with your customer care representative, and also, as we've said, you know, you really need to see your clinician to be assessed for this device. So I think most people that have a voice prosthesis still see their clinician. If that's not the case, as I say, get in touch with a customer care team and they'll be able to help you and guide you to the right direction to get your hands on the system. All right.
It tends to work better and be more successful if you've gone through the assessment process with the clinician, just so he or she can advise you on which membrane strength to use in which situation. Because if you, for example, just put on any membrane strength, it might not work for you. So it's going to be a big bonus to have that assessment procedure carried out to find what you need.
Great. Any more, Jack?
We've had some people feeding back. Some people wear the free hands every day. Some people wear it occasionally. It just depends on what they tend to be doing.
Yeah,
and
absolutely.
that dictates when they wear it.
Yeah,
it's their personal choice.
Yeah, it's really got to fit around your life, hasn't it? It's really got to be, you know, some people are kind of much more, I guess, active, more out and about than others are. You know, if you kind of spend a lot of time at home, you might not feel kind of the need to use it every day. If you kind of have a slower paced life, I guess. If you're still working, you're still, you know, lorry drivers and delivery drivers. I've seen a few of those job roles out and about between our patients that we have registered with us. You know, it's really got to fit around your life. So definitely, I'm not surprised there's a mixed bag there, to be honest. Cliff uses it occasionally, not every day. He finds it's better in quiet environments, not in a pub. I think that, you know, that it could be a double-edged sword, as Alison said earlier, to do with kind of how good your voice is in the first place sometimes. So a lot of these things are always kind of multifactorial, aren't they? So good. Thank you guys for your feedback on all of that. Really, really good.
And it sounds like, sorry, Alison.
No, go on, Jack.
And Michael's said that he uses the stability base plates, but he finds they're not big enough to cover his stoma when he's.
Yeah, Michael, I definitely would kind of reach out, as we've been saying, you know, to a clinician, or I don't know, I'm not sure where your location is, but you know, you might be able to have a nurse come out to you and have an assessment, you know, on your base plate, just to see if there's anything we can do to fix that problem for you. There's a few different things, as Alison said. There's normally a solution, a little bit of trial and error here and there, but normally there's a solution we can come up with. So sorry that you're struggling, but definitely reach out to either your clinician or us to come out and see you. All right. And Anne, she's intending to use hands-free, you know, that's good. Michael had a clinician come out 14 years ago. Oof, it's been a long time, Michael. Definitely get in touch with us, and I'm sure we can come out and see you. It'd be it's always nice to come out and see you guys in your home. So yeah, feels like we can have some input for you there. Alan tends to use it at home or in social settings. Good. So yeah, real mixed bag of you guys here, and the way that you're using it, and the way that you kind of make it fit into your life. So it's really great to hear. Can anyone come to Mull?
Oh.
I don't know where Mull is. I'll have to check the map. Shall we check the map, John? And we'll get back to you on that. Okay.
Michael asked if we come to North Wales, and we do. That's actually my area.
There you go.
I'd be happy to come to North Wales to come and help you with your base plates.
There you go.
Now the west coast of Scotland.
Oh, John, we're gutted. We actually don't have a nursing service in Scotland. It's just, you know, to do with the slight different way the NHS runs up there. So definitely reach out to your clinician up in Scotland. Okay. Cornwall, yep, I know it's unfair, John. Trust me, we would love to be up in Scotland. We'd love to come out up there. It's a little bit out of our hands, unfortunately. Maybe one day it will change, but have a chat with your clinician and see what they've got in mind. It might be that, yeah, it might be that one of the clinical education team can pop up to see a clinician in the hospital or something and bounce ideas off each other. I don't know. As I say, we'll normally help you find a way. Cornwall, yeah, we come to Cornwall. So a little bit. We're most places, aren't we, Jack? The nursing team.
I think we're everywhere, aren't we?
Feels like
unfortunately,
that.
yeah. Not Scotland, unfortunately, but I think we cover.
Yeah,
England and Wales, definitely.
Good. So yeah, and as I say, if you're not sure kind of where we cover, or where we can come out to, you should have a customer care representative in the office that touches base, or a best start nurse. It might be it depends how long you've been registered with us as to whether you still have a nurse on the phone or whether you have a customer care representative on the phone. But whoever you speak to for kind of your monthly orders and things, and whoever checks in with you, then reach out to them and they'll give you some advice. And as I've mentioned earlier, do log on to that workshop next week. You can have your cameras on, you can speak to us, unmute yourself and speak to us. You don't have to have your cameras on, saying that as well. So yeah, join us next week. It would be lovely to see you there. It's nice to speak to some faces. Good. So, I mean, I've just noticed the time flies when you're having fun. We've just noticed we are running a little bit over. So I think we will leave it there. Hopefully we have answered most of your questions. Again, to register for the workshop, that is just in the chat, and as is a survey. So kind of before you leave, there'll be a survey pop up, and if you could just spend a minute or so answering that survey, would be very, very grateful. Helps us out a lot with our future webinars and everything. So, and thank you everyone for joining today. It's been lovely to chat to you all. Thank you for your input.
Thanks everyone for joining. It's been great.
Yeah, amazing. Okay, guys, well, we'll leave it there. Thank you so much, and we will see you all soon.
Take care, everyone.
Bye.
Take care. Bye.
Bye. Bye.